Whenever large infrastructure projects, such as mines, are developed in a rural area, local communities experience changes in their social and physical environments. Positively, the mine can boost the local economy or contribute to community development overall. Such changes could potentially improve community health and well-being in the long term. Negatively, the arrival of a mine can also increase contamination of air, water, and soil. This and the rapid influx of people can add to the strain on often weak and overburdened public infrastructures. When infrastructures are under strain, diseases spread more. One factor large mines can positively and negatively affect is local water infrastructure. Clearly, safe and clean water is key to good health and well-being. Before such big projects are developed, their potential impacts should be assessed. So-called impact assessments identify positive and negative impacts, including health aspects. The final impact assessment report includes a mitigation plan. The aim of such a mitigation plan is to minimize negative impacts and maximize potential benefits for local communities.
Where natural resources are extracted, assessments show if the impact on the water infrastructure is positive or negative, and how big these positive and negative impacts are. Ultimately, the impact assessment shows how the new mine affects the local water and how this affects the health of communities. To understand these connections, we combine quantitative and qualitative data. With the quantitative data, we analyze the settings from a macro level. This is complemented by micro-level qualitative data. To quantify the mine's impact on water infrastructure at the national and supranational levels, we combined data from all demographic and health surveys, short DHS, in sub-Saharan Africa. We then used another dataset featuring all large mines in Africa to select approximately 200,000 households located in proximity to a mine. Using regression models, we analyzed the impact of having a mine nearby. To better understand the impacts of mining projects on local water infrastructure, we visited 2 industrial gold mining sites in northwestern Tanzania. In villages around the Buswagi and Bulyanhulu gold mines, we engaged with community members. 1 year later, we visited the villages again to map and observe sources and water bodies mentioned by the community members. Additionally, we screened environmental impact assessment reports for water-related issues. The quantitative data showed that water infrastructures in communities around mining projects are more developed compared to non-mining regions in sub-Saharan Africa. The closer the households were to a mine, the more improved water sources, such as piped water, were available. Overall, the households in the first 5 kilometers from a mine were around 4 times more likely to have access to piped water than households further away. However, these benefits were not distributed equally, with poorer households profiting less. The same pattern exists when focusing only on Tanzania. These findings from the DHS data were mirrored by the qualitative data from our visits to Buswagi and Bulyanhulu. In both sites, the mine installed or financially supported many different water access points for surrounding communities. These included taps and pumps. Zooming to the 2 sites, we see the locations of some of these investments. Community members living around the Bulyanhulu mine said how important new and reliable drinking water sources such as taps and drilled wells were. For example, one participant told us,
"There's a drilled well also contracted by the mining company, and we're using water from this well for drinking. Also, the well is fenced and there's a tap. It is a modern one."
Around the Buswagi mine, More than a dozen new pumps were installed in several villages. However, participants reported that some pumps are not operational, and we found several pumps abandoned. Besides technical aspects, participants from both sides reported negative impacts on the water availability and quality. They described that their wells are dried up and suspected the reason was that the mine needs more water. More importantly, they complained about the poor water quality. They said the water in their wells is smelly, salty, or oily. According to the participants, chemicals get into their unprotected wells through the air or penetrate the water sources underground. They said,
through blasting activities where the water from the poison dams can penetrate underground and enter into our water sources.
Also, local residents were afraid to use the rainwater, which they traditionally collect as drinking water. Blasting in the mines sends black particles into the air that land on their roofs. This dust is washed directly into their water collecting systems. In the words of a participant,
"You cannot fetch rainwater because it is black due to the dust stacked on the roof. You cannot drink it. The water is not safe. That water causes miscarriages, causes diseases like urinary tract infections and stomach diseases. So we do not trust the water that we use."
we then wanted to know if better results can be explained by better mitigation plans in impact assessment. But when we looked at the impact assessment reports of the two mining projects, we saw that this was not the case. Both reports included aspects related to the water quality and quantity. But the outcome in Bulyanhulu was better, even though the mitigation plan in the Bulyanhulu report covered less than the Buswagi report.
In summary, this study combined quantitative and qualitative data and offered macro and micro level perspectives. The findings indicate different impacts of mining companies on water infrastructure and on health. From the macro perspective, we found overall positive impacts of mines on local water infrastructure. So, water infrastructure around mining projects is more developed compared to non-mining regions. On the other hand, both the macro and the micro level analysis showed that there are pockets in society that do not profit from these positive impacts. Although the mines build new water access points, availability and access to clean water is still a major issue, particularly when the mine uses chemicals that pollute the environment. This is a major concern for the residents of the surrounding communities. Taken together, we can conclude that mines play a big part in both positive and negative impacts on water for local communities and their health. Impact assessment could be a promising tool to manage these impacts. Our results point out that this tool should be used to address communities' needs in an equitable manner. This includes the health and well-being of the most vulnerable populations. Most importantly, anticipating future impacts is not enough. In addition, ongoing and collaborative management and monitoring are essential to ensure any positive effects. In the spirit of the 2030 Agenda for Sustainable Development, Leave No One Behind, inclusive impact assessment of mining projects together with community liaison activities could make it possible to strive towards universal access to water for all as a key element for health and well-being.